I am a respiratory physician, a special interest in sleep disorder breathing. If you take the geriatric populations, 60 plus, we call it as elders or geriatric population, we come across various respiratory issues. Commonly, once age advances, the immunity, the immune system, the fighting function is slowly declining. We call it as immune senescence. The weakened immune system, which leads to lot of infection, mainly the lung infection due to bacteria, virus, we call it as pneumonia. Pneumonia is a preventable, treatable and curable disease. For pneumonia, we have effective vaccinations, annual flu injection for influenza pneumonia, H1N1 pneumonia, and we have a pneumococcal pneumonia. It is a very common community acquired pneumonia due to streptococcus. So, once the patient develops pneumonia, so we can easily identify cough, fever and chest radiography, sputum test. So, we can easily treat with the antibiotic and antiviral antibiotic. So, in general, pneumonia is preventable, very commonly seen in the elderly populations. Other common disease we come across in our practice is the sleep apnea, that is sleep disorders. In sleep disorders, we have two types of sleep disorders commonly seen in practice. One is the insomnia. Insomnia means lack of sleep or not able to get proper sleep. This is insomnia, and we are seeing the sleep apnea. Sleep apnea is a condition comes under the sleep disordered breathing, or we call it as snoring disease. So, தூக்கத்தில் சுவாச அடைப்பு, snoring is a very important symptom of sleep disorder breathing. This also easily treatable, controllable. Once age advances, the upper airway muscles will relax, which causes snoring and respiratory block, which leads to apnea, hypopnea, choking, gasping, which leads to lot of complications. So, the sleep apnea is a treatable, controllable and manageable diseases. So, elderly populations are very prone to get. So, we see commonly the obstructive sleep apnea, one of the common respiratory disorder. We do a sleep test to confirm the sleep apnea, and we have a multi-modality of treatment available with the PAP therapy, that is a positive airway pressure therapy and other supportive medications. The sleep apnea is commonly associated with a thyroid hormone deficiency called hypothyroidism. In hypothyroidism, majority of the people, they have a tendency to develop the apnea, hypopnea and obstructive sleep apnea. So, we can correct the hypothyroidism and we can control the disease effectively, easily. And other important disease we come across in our practice is the obstructive airway disease, mainly asthma and COPD. COPD, because of the pollution, that is a smoking induced lung disease, we call it as a chronic obstructive pulmonary disease or COPD. This is a preventable, treatable, manageable disease. COPD, we have to stop smoking, stop inhaling all noxious particles, pollution, etc. So, we have vaccination program and we have a pulmonary rehabilitation program for effective management of the obstructive airway disease like asthma and COPD. So, the vaccinations very important, and pulmonary rehabilitation is very important in elderly populations, and we have the all relaxation technique of respiratory muscles and the avoidance of pollution, smoking cessation, all the important preventive aspect in elderly populations. Thank you.